The most common question patients ask their glaucoma specialist is, am I going to go blind? The second most common questions that patients ask their glaucoma specialist is there any new research or new treatments that will help me? The first question is rooted in fear, and the second question is rooted in hope. The talks, the panel discussions, and the hallway discussions that happen today at New Horizons are rooted in that spirit of hope. We, the innovators in the glaucoma space, are the hope makers. This is a photo of my 94-year-old mother with her 95 and 96-year-old brothers just before these three took a walk. These photos remind me about why we do what we do. Each of these three elders has a chronic eye disease, and look how they're thriving. Eugene Dewan opened our session this morning with the comment that quality of life is the defining issue of our work together. So let's reflect at the end of the day for a moment on why we do what we do and the underlying value of our work. Our work of research, of developing new products, and of transforming glaucoma care. The unifying goal isn't simply to lower intraocular pressure or slow visual field progression or to cultivate interventional glaucoma. The unifying goal isn't to get FDA approval or to develop a good revenue model or to get on the right insurance tier or to convince ophthalmologists that our product is a good choice. The bedrock of our collective work is to enhance the quality of life for our patients. And this is why I love being a glaucoma specialist. And this is what gives so much vibrancy to our glaucoma innovation space. Even on the most exhausting and the most challenging day in the clinic or in the OR, a glaucoma specialist has a deep sense of doing meaningful work. And I want each of you in the innovation space to experience that feeling also. You know, there are courses and fellowships and conferences about innovation, but the real value comes from being around other people who think and live the innovation way. You know, Glaucoma Research Foundation is founded in this value of collaboration. One example are the CFC research models, a collaborative research model that'll take 4 or 5 labs from different academic departments together to work on a common problem. And these are a picture of the CFC4 team who's working to identify pathways, common pathways by several neurodegenerative diseases. And GRF is also committed to a collaborative approach to the entire life cycle of glaucoma innovation. And its new treatment accelerator initiative funds that critical stage of the preclinical studies and phase 1 studies. And I have to comment on something some of you might not realize that is one of the most valuable things is patient education. My patients love GRF materials. And this beautiful big brochure that I give to every one of my new patients, that even the size of the brochure makes it feel so important to them. Often, I'll simply write on a notepad, glaucoma.org, and hand it to the patient after they've asked me, is there any new research? And yes, thanks to all of you, there is. Innovators are special humans. You are curious, you are courageous, You don't accept that's the way it's always been done. You are only a little bit afraid of failure because you know that failure is an unlocked door to a new and more creative solution. But what I like most about innovators is your deep inner drive. I've been reading about Alexander Graham Bell, and everybody knows he invented the telephone. But did you know that he was bold and relentless in getting the business community to pay attention to his new invention? And then when James Garfield, the 20th president of the United States, was shot, and he was receiving medical care in the White House, Alexander Graham Bell moved from Boston to Washington, D.C., where he opened a lab and feverishly worked to develop a device to locate the bullet. When he finally took his apparatus to the White House, the entire nation was watching. His apparatus, his machine, was called the induction balance, and it malfunctioned. And he was not able to identify the location of the bullet. And instead of withdrawing in humiliation, Bell went back to his lab and figured out what had gone wrong, refining the technology that gave birth to the modern X-ray and metal detectors. And then, after the death of his premature son, Edward, he developed a vacuum jacket to assist infants in breathing. And this was an early iteration of the iron lung. While Alex Bell is no icon for work-life balance, he is an icon for persistence, resilience, and recovery from failure, and ultimately extraordinary successes. And when I look out at this room, which is really fun to look out at all of you, I see resilience, persistence, and curiosity. And I see the people who will utterly transform glaucoma care and eventually cure glaucoma. And here's the interesting part. By simply being yourselves, you people with this inner drive, you contribute to this extraordinary culture of innovation, which is actually even more impactful than bringing a new treatment to market. So you've seen this picture several times today. Jack Hetherington, Bob Schaefer, and Dunbar Hoskins started Glaucoma Research Foundation. These men were creative thinkers, and they took bold action. Even though these three are no longer with us, their thoughts and their comments and their wisdom ping around in my head to this day. And their character and the people that they are continue to influence me, and they are still my teachers. Young ophthalmologists and young researchers and young innovators might not even know who these guys were. Most of us are forgotten after a generation. But our real legacy is the culture and principles that survive so long beyond us. And Eugene Dewan pointed this out this morning when he said that our philanthropy has a lasting impact, and indeed it does. Even the innovations we're applauding today and looking for today will seem quaint someday. But what will persist is our spirit of innovation and that drive, like Alexander Graham Bell's, to make life better for others. I'm taking a 4-year humanities course at University of Chicago. And this month, actually, I'm reading Aristotle's Nicomachean Ethics. And I thought it was just for fun. I thought I was just doing this for fun. But the more I read it, I've discovered that Aristotle has absolutely everything to do with what we are doing as innovators. He taught that human flourishing is living a life rich with meaning and fulfilling one's unique human potential. So let me remind this extraordinary audience of innovative thinkers and doers that your work has deep value, not just for the glaucoma patients today and tomorrow, but for the entire culture of innovation. You are the hope makers. Thanks.